Earwax. Earwax is composed of secretion of sebaceous gland, ceruminous glands, hair, desquamated epithelial debris, keratin, and dirt. So the earwax is composed of the sebaceous gland, glands, ceruminous glands, hair, desquamated epithelial debris, that is epithelial debris, keratin and dirt. The sebaceous and ceruminous glands, these are the modified sweat glands. These two are the modified sweat gland. They are the modified sweat gland. These open into the space of the hair follicles. These two glands open into the hair follicles. The sebaceous glands provides fluid-rich fatty acids. And the ceruminous glands provides lipid-rich fluids. The ceruminous glands provide lipid-rich fluid. And pigmented granules, they also provide the pigmented granules. Wax has a protective functions. These wax, which is composed of sebaceous gland that provide fatty acids, and ceruminous gland that provide lipid-rich fluids, and pigmented granules in hair, epithelial debris, keratin, and dirt. These two, sebaceous gland and ceruminous glands, they provide the protective functions, and wax provide the protective function. It lubricates the ear canal. These wax lubricate the ear canal, and these wax also entraps the foreign body materials that enter the canal. When foreign body material enter the canal, it entraps by the wax, so they entraps foreign body. The wax has acidic pH. These wax has acidic pH. This acidic pH has a bacteriostatic and fungistatic function. These wax have acidic pH. This acidic pH provides bacteriostatic that prevent the growth of bacteria, they stop the growth of bacteria, and fungistatic functions normally. In normal person, a moderate amount of wax are present. Only a small amount of wax is secreted, which dries up and later expelled from the meatus by the movement of the jaw. Normally, small amount are secreted of wax, and they expel later from the meatus by the movements of the jaw. Expelled by the movements of jaw. When excessive wax are present, they secreted, but they are deposited as a plug in the meatus. When this wax are excessively secreted, they are deposited as a plug their deposit is a plug in the meatus. Certain other factors, example narrow ear canal, can also prevent the clearance of these wax, and they are deposited. There also, when obstruction is present, in cases of the obstruction, it also prevents the expulsions of these wax, and they are deposited as a plug in the meatus. There is retention of wax in this case, and they form hard. When there is obstruction or narrow ear canal, there is retention of wax. When they are retained, they become hard. And they form impacted mass. In this state, the wax is called impacted wax. This is called impacted wax. So the impacted wax is the retention of the wax, so in their deposit, so is a plug in the meatus due to the narrow ear canal or obstruction or stiff hair or other problem. The patient usually the presenting complaint of the patient usually is the hearing loss or impairment of hearing since blocked ear. They block the ear, block these impacted wax, blocked ear, and there is hearing loss or impairment in the hearing. So this results of tinnitus. Tinnitus are a ringing sound in the ear, and is a result of the impacted wax. The wax are impacted against the tympanic membrane. They are also impacted against the tympanic membrane. So the hearing decreases, and the reflex cough are also occur. The reflex cough is due to the stimulation of auricular branch of the vagus nerve may sometime occur. The presenting complaint, the reflex cough are also occur as a result of this due to stimulation of the auricular branch of the vagus nerve. The onset of the symptom may be sudden when the water enters the ear canal during bathing or swimming, and wax swells up. And this wax, when swell up, they may ulcerate the meatal skin, and the formation of granuloma also occur. There it is called wax granuloma. Wax granuloma also formed when they swell and during the bathing or swimming. The treatment for the impacted wax consists of the syringing techniques. The syringing techniques, the patient is seated with and syringe toward the examiner hands are applied, and the towel is placed around the neck of the patient, and the patient head is tilted over the tray to collect the return of fluid. In the procedure, the pinna is pulled forward and backward, and streams water from the ear syringe is directed along the posterior superior wall of the meatus. The pinna is pulled upward and backward, and stream water from the ear syringe is directed along the posterior wall of the meatus. Pressure of water pulled to deeper to the wax. So if the wax is tightly impacted, normally we syringing. By syringing, we remove the wax. If the wax is tightly impacted, it is necessary to create a space between it and the meatal wall for the jet of water. The syringing, when the syringing is ineffective, it may even push the wax deeper. When the wax is hard, it push the wax deeper. So we soften the wax first. To soften the wax first, normally we use the boiled tap water cooled to body temperature, and too much force used in syringing may rupture the tympanic membrane, so we use the other wax softener to soft the wax. The material used for the to soften the wax is 5% sodium bicarbonate in equal parts of glycerin. There is 5% of sodium bicarbonate. Sodium bicarbonate may be used, and glycerin also used in equal amount. Sodium bicarbonate along with the glycerin in equal amount is used to soften the wax, and water installed 2 to 3 times a day for a few days. Installation of water for few days to soft these wax along with the 5% of sodium bicarbonate and glycerin is also used. Other material used for to soft the wax is hydrogen peroxide, liquid paraffin, or olive oil. The hydrogen peroxide also used. Hydrogen peroxide also used in liquid paraffin. Liquid paraffin is also used to soft these wax. Or olive oil may be also used. The other agents used to soft the wax is the para-dichlorobenzene 2%. Para-dichlorobenzene 2% is also used. Para-dichlorobenzene 2% is also used to soft these wax for few days. If the syringing is not benefit, because if it's hard wax, it push the wax deeper into the ear canal that may rupture the tympanic membrane. When the wax becomes soft after a few days of the application of 5% sodium bicarbonate in equal amount of glycerin in water is installed 2 to 3 times a day, or the using of the hydrogen peroxide or para-dichlorobenzene 2%, the wax can be removed by the instrument manipulation. The instrument should be used by the skilled hands and under direct visions. Cerumen hook, scope, or Jobson horn probe are often used. Cerumen hook, scope, cerumen hook, scope, or Jobson horn probe. Jobson horn probe often used to create a space between the wax and metal. To create space between wax and metal wall. And the treatment after this wax removal is the use of antibiotic ointment to prevent the infection, because the infection can also occur in the cases of the wax removal. The other method for wax removal are through suction and also through the forceps removal. Mostly the wax are removed by syringing method. Occasionally the wax become hard due to too long time of the wax deposits in the ear canal.